A dedicated scientist, family man, and a true servant leader, Dixie E. Snider lives his life in service to others. He achieved the rank of Rear Admiral in the Commissioned Corps of U.S. Public Health, where as Chief Science Officer in the Centers for Disease Control and Prevention, he had a profound impact on the public health of the nation.
He's highly respected for his scientific expertise, his ability to work with people and use suasion with people to convince them of what really needs to be done. And he's also very personable and really loved by everybody. And a lot of that goes to his ideas for servant leadership.
Dixie came to science early as the oldest of 3 children born to a family practitioner and a nurse. The Snider house on Walnut Street in Springfield, Kentucky was a hub of activity, with Dr. Snider's medical practice located in the front and the family quarters in the back of the residence. It was there that young Dixie acted out his favorite comic book heroes and big screen cowboys in the family's backyard, and it was there that Dixie cultivated his love of science.
I wanted a chemistry set, and my parents bought me a chemistry set. But I quickly also became interested in microbiology and put eggs and bread and stuff out to see what would grow on them and examine it under a microscope and mix up chemicals to see what would change color and that sort of thing. It was a lot of fun.
I remember early on that he almost blew up his bedroom with an experiment with that chemistry set, and that I don't remember after that any extensive experiments that he did.
Following in his father's footsteps, Dixie attended Western Kentucky University. Once on the Hill, the freshman chemistry major joined Phi Sigma Tau fraternity and was a member of the Reserve Officer Training Corps at WKU. When his studies took a back seat to his social life, Dixie hit the reset button.
I really tanked in several classes, including my chemistry classes. Didn't pass them. But as I mentioned to you earlier, I spoke with professors, and I remember Dr. Wilson in particular, and he was, I thought, would maybe tell me I needed to major in something else or go into another field, and he didn't. He said, basically, he knew the problem. He said, you know, you didn't work hard enough. You're capable, but you just need to decide to do it. And I did.
By 1964, Dixie made the honor roll, graduated from Western a year later with a degree in chemistry, and went on to medical school at the University of Louisville. He graduated first in his class. He married his longtime girlfriend Fran, then trained at Washington and at Vanderbilt universities. He is board certified in internal medicine, allergy, and clinical immunology. Dixie received a Master of Public Health from Emory University in 1984. Public health was not his first career choice, but to pay back the government for his education deferment during the Vietnam War, he became a commissioned officer in the Commissioned Corps of the Public Health Service within the Centers for Disease Control and Prevention.
And when I got into it, the obligation I had was for 2 years to pay Uncle Sam back for deferring me from fighting in Vietnam. And they, at CDC, started teaching me about public health.
In his time with the CDC, Dixie rose from a tuberculosis medical officer to chief of the Research and Development branch of the Division of TB Control, and was later appointed director of the Tuberculosis Division as a chief scientist in the office of the director. His guiding principle? Always stay true to the science. When tuberculosis resurfaced in the United States in the early 80s, Dixie helped author a plan for the elimination of the disease, a plan still in use today. In medical circles, he is lauded for his knowledge, diplomacy, and fearlessness.
One of the things that he brought out when we developed the plan was that we had to do things differently, and that was one of the reasons for the plan. And I've heard him quoted many times. He said at the national meeting, one of the national meetings when we were talking about this, he said, you know, if you always do what you always done, you're always going to get what you always got. And he's been widely quoted whenever something new comes along that we need to implement and do in science or in public health. He's used that.
Dixie has received numerous honors, including the United States Public Health Outstanding Service Medal, the Meritorious Service Medal, and the Secretary's Award for Distinguished Service. With all his commendations, Dixie is most proud of his family, his Kentucky roots, and the role he played in arranging for the 1997 presidential apology for the Tuskegee syphilis study.
When they had very difficult things to do, he was a person you wanted to be involved in that, but I'm sure he consulted with a number of people, including the people involved, to make sure that the letter would strike home with the persons who were involved, the victims of the Tuskegee study.
Since his retirement from public health in 2006, Snider and his wife Fran have devoted themselves to their church community, helping to ensure the nutrition, health, and well-being of the people in and around St. Bede's Episcopal Church in Atlanta, Georgia.
He's very passionate about serving others and making sure that everyone has the food they need to eat and the health care they need and whatever resources they need, and he works tirelessly to provide for other people. I hope I can grow up to be like Dixie.
2019 WKU Hall of Distinguished Alumni inductee, Dr. Dixie E. Snider.